Have you ever wondered about the fluctuating emotions that someone close to you is going through? It can feel as though you're sailing through turbulent waters, encountering both peaks and valleys, and occasionally finding yourself in unfamiliar territory. Today, we set out on a path to explore the intricacies of bipolar disorder and borderline personality disorder. These two mental health conditions that are often misunderstood and can become intertwined. Come along on a journey as we explore the depths of emotions and uncover the distinct characteristics that set bipolar disorder and borderline personality disorder apart. Welcome back to Wellness Lenses, where every conversation is a deep dive into mental wellness. If today's topic is something that appeals to you, please consider subscribing to our channel for more content on mental health and psychology. Shall we begin with a quick summary? Bipolar disorder involves experiencing intense shifts in mood, from periods of high energy and excitement to episodes of low moods and sadness. On the other hand, borderline personality disorder, or BPD, is characterized by unstable relationships, self-image, and emotions, which can often result in impulsive behaviors. Although both share similarities and mood disturbances, it is important to recognize the significant differences between them. First up, let's explore the differences in the nature of mood swings. Mood swings are a prominent feature of bipolar disorder, lasting for extended periods of time and being particularly intense. People with bipolar disorder go through episodes of mania where they have increased energy, act impulsively, and feel euphoric. These episodes are often followed by intense periods of depression where they feel extremely sad, tired, and have a low sense of self-esteem. The mood swings persist, lasting for extended periods of time, forming a noticeable pattern that clinicians can observe. On the other hand, borderline personality disorder is characterized by swift and intense mood swings that can change within a matter of hours, or even minutes. These emotional fluctuations can be triggered by external events, especially interpersonal conflicts, resulting in a turbulent internal landscape. The shifts in BPD are reactive and closely tied to specific stressors, unlike the more prolonged episodes seen in bipolar disorder. The distinction in the timing of mood swings is crucial for differentiating between these two disorders and helps therapists customize suitable interventions. The second difference has to do with the complex aspects of relationships and self-image in bipolar disorder and borderline personality disorder. During manic episodes in bipolar disorder, individuals may exhibit risky behaviors and increased energy levels, while maintaining a consistent sense of self. However, during depressive episodes, these patients may experience withdrawal and difficulties in maintaining relationships as a result of the immense weight of sadness they carry. On the other hand, borderline personality disorder is characterized by consistently unstable relationships and self-image. People with BPD often struggle with a deep-seated fear of being abandoned, which can result in them going to great lengths to avoid any form of rejection, whether real or imagined. In addition, individuals with BPD often go through frequent changes in their self-identity, which can lead to a constant sense of instability in their overall sense of self. Dealing with the challenges of identity and relationships can sometimes lead to impulsive behaviors, such as self-harm or risky actions, driven by a strong desire to avoid being abandoned. It's crucial to acknowledge that these relational and self-image challenges, although present in both disorders, manifest in unique ways, guiding mental health professionals towards personalized therapeutic approaches. The third difference lies in the response to treatment and the different approaches in managing bipolar disorder and borderline personality disorder. Pharmacological interventions have been found to be effective in treating bipolar disorder, especially mood stabilizers and medications that address mood episodes. These medications help to balance the highs and lows of mood swings, giving individuals a more consistent emotional foundation. In addition, psychotherapy, such as cognitive behavioral therapy, can be helpful in addressing the cognitive aspects of the disorder. On the other hand, psychotherapeutic approaches have shown positive results in treating borderline personality disorder, particularly dialectical behavior therapy. DBT emphasizes the development of emotional regulation, interpersonal effectiveness, distress tolerance, and mindfulness skills. Treatment primarily focuses on addressing specific symptoms, such as depression or anxiety, and medications may be prescribed to assist with this process. Understanding these different reactions to treatment is essential for mental health professionals, helping them to provide personalized and effective interventions. Let's delve into the triggers and distinctions within the context of bipolar disorder and borderline personality disorder, which is the fourth major difference between these two mental health conditions. Mood episodes in bipolar disorder can often be triggered without a clear connection to specific external events. The shifts between manic and depressive states can happen unexpectedly, making the disorder less predictable in its onset. Understanding and managing bipolar disorder can be quite complex due to its unpredictable nature. However, individuals with borderline personality disorder often experience intense emotional shifts that are commonly triggered by external events, especially conflicts in their relationships. People with BPD often experience intense emotional reactions to feelings of abandonment or rejection, which can result in impulsive and potentially harmful actions. Recognizing these triggers is crucial for both individuals and their support systems, as it enables them to anticipate and navigate difficult situations. Regardless of the differences, it's important to approach these conditions with a compassionate and empathetic mindset. People dealing with these bipolar disorder and BPD often feel alone, judged, and misunderstood. If you or someone you know is going through a difficult time, it's important to remember that reaching out to a professional can be a brave and positive choice on the path to healing. Now, feel free to share your thoughts or experiences in the comments below. Have you had personal experience with these disorders, or have you witnessed them in someone you know? Your stories have the potential to provide comfort and guidance to others who are going through similar experiences. Also, please consider subscribing for more thought-provoking content like this, sharing this video with your friends and family, and giving it a thumbs up if you found the information valuable. Ultimately, it is crucial to grasp the subtle distinctions between bipolar disorder and borderline personality disorder in order to cultivate empathy and offer the necessary support. Let's keep this conversation going, challenge the negative perceptions around mental health, and strive for a world where everyone feels acknowledged and understood. See you in the next video.